Hi, my name is Michaele Hatfield, and I have a story I would like to share with you. It is a story about my 12-year-old son, Jordan, who couldn't walk for about 4 months. And it probably would have been longer had it not been for a man named Jerry Hesch. About a year and a half ago, Jordan had pain in the lower right-hand side of his back for the first time. We went in to be treated to the ER. We had no answers. We did have an x-ray done. No one could tell us anything. We went home. A few months later, the problem occurred again. When the problem would occur, Jordan was not able to sit up straight, and he could not walk. He could walk, he could take a couple of steps, but it was very, very, very painful. A couple of months would go by, it would happen again. And then it became more frequent. I want to look at a timeline here. Around May of 2009 is when it started becoming more frequent. We went into ER in May of 2009. June, went into ER. We actually had a CT scan done at some point in there because the abdominal pain that was accompanying it was so severe that they thought possibly it was appendicitis. The abdominal pain overall accompanied the lower right back pain about 1 out of every 3 times. Because the abdominal pain was occurring, in the beginning, I thought it was possibly a GI problem. I got a referral for a GI doctor. We talked about celiac, Crohn's disease, did blood work. Pretty much, ultimately, I ruled all that out because I noticed that since it was only 1 out of 3 times, the back pain was there always. And so I finally decided that it was probably pain radiating from the back into the abdominal area. The celiacs did come back negative, but the Crohn's was still open as a possibility. They sent me home with medication for a spastic colon. I did give that to him when he had the abdominal pain as suggested, and he actually got worse that day. I don't believe it was because of the medication. I believe that it was just coincidental, but I did stop giving him the medication. My gut instinct told me there was no intestinal issue. By this time, he hadn't had diarrhea or any other associated symptoms. We went to Children's Hospital, Riley Children's Hospital in Indianapolis. I took him into the ER there when he was in such severe pain in the abdominal area and the back that he couldn't walk again or sit up straight. They did a bunch of testing, couldn't give me any answers, sent us home. Back to where I started. No answers, nobody's helping, what do I do? He improved, but then it came back. We're back in the ER. We're back in the doctor's office. We go through the same thing over and over, no answers. I finally ask if I can get a referral for an orthopedic surgeon. Children's Hospital, Riley Children's Hospital again. We go see the orthopedic doctor. He doesn't gate him. He doesn't poke and prod at him. He doesn't check to see if one leg is higher than the other. He asks him a couple questions. One, where does it hurt at in your legs? He doesn't have pain in his legs. We never said he had pain in his legs. Very specifically pain in his lower right-hand side of his back. The day we went in, he actually had abdominal pain accompanying. But they told me straight out, we don't deal with abdominal pain. Okay, you have a patient. They have abdominal pain and back pain on the lower right-hand side. They just dismissed it. No theorizing, no research, no questions, no help. They sent us to get an x-ray done. We did that right there in the hospital, got the x-ray, x-ray came back normal. And then we were told to schedule an MRI. We did. That came back normal. Then we scheduled a whole spine MRI at the doctor's request. That came back normal with the exception of a small node on L1. Keeping in mind during this time, I actually had a doctor look at my son and say, oh, he looks fine to me, even though he couldn't walk. Thank you. Jordan's missing school. I have to keep taking him in and get doctor's notes, even though the doctors can't help him. I just have to walk in and say, look, see, he's still not walking. Can I have a note? Thank you. I'm dealing with a school counselor who was not always very nice. Some of the teachers were very helpful. That was wonderful. I couldn't send him to school during this time because he can't sit up straight. He can't sit in a chair. He can't walk from class to class. He could sit in a wheelchair if he could recline all the way, but I couldn't find a reclining wheelchair. Plus, at this point, it's intermittent. The second MRI comes back. This is what the doctor writes. The treatment for this is really not a lot other than just some mild pain control issues, and at the most going into a brace. A good physical therapy program to strengthen the back muscles. Okay. A. Strengthen the back muscles. This is my son Jordan at 6 months old. My son Jordan is an athlete. This is Jordan in the 3rd grade, IHSAA State Championship, Indiana State. Jordan was golfing when he was 3 years old, for hours at a time. Jordan plays traveling baseball, traveling basketball, football, and golf. My son Jordan has a very strong back. My son Jordan is one of the most fit people I know. If you did go to physical therapy, Jordan, well, what kind of exercise would you do? If you don't have a diagnosis, you don't just do exercises because you can make yourself worse. I didn't go to medical school, but I can figure this one out. Put a brace on him. Yeah, we have pain. It is so severe and so tender in the abdominal area and in the lower back at times that putting a brace on it and putting pressure on something would make it worse. And what is the point of a brace if you don't have a diagnosis? Thank you. We were back to square one. I'm at 7 minutes on this video. I only have 10, so I'm going to try to get to my point. In November, I was referred to a very kind man who actually was the first person that poked, prodded, pulled, and looked at my son and diagnosed my son with an upslip. He sent us home with some exercises. Jordan started doing these exercises, and he worsened. He was curled up in a ball for about 2 days in severe pain. I knew we were onto something, and I knew that this man had studied the Hesch Method, Jerry Hesch. And I got on the phone on November the 19th. I called Jerry. I got him off the internet. We spoke. He was very concerned immediately. He mentioned Jordan possibly coming to Las Vegas, which was great because Jordan's dad had just moved there. He's in the Air Force and just come from Okinawa. I was able to put Jordan on a plane, gave him some medication, and gave him a direct flight so he wouldn't be in pain for too long. Jerry knew over the phone right away what was wrong with my son. He wouldn't tell me that as a diagnosis, but he knew. He fixed my son on the first visit. My son was able to walk, and by the second visit, I believe he was pretty close to 100% back to normal. Jordan today is normal, walking around. It's a little sore at times, still trying to get used to everything because it's January and this just happened last month. So we're nearing up on 10 minutes here, and I want to give information for Jerry, his website, HeschManualTherapy.com, HESCH manualtherapy.com, and HeschMethod.com, HESCH method.com. And he has a YouTube video that talks about the upslip and the downslip and how an upslip can be commonly, a downslip can be commonly misdiagnosed as an upslip. And he's very informative and does seminars, and I really want to get this information out there so that no one has to go through what we went through. Please check out his website. Thank you.